And I'm going to tell you a little bit about each one of those things before we get started. So mindfulness is about being present in the moment we're in. It's about focusing our attention on what we're experiencing. And it's about just being present in what we're doing. And what that does for us is the default mode for human beings is to worry, just to fret about the past and worry about the future. And when we are mindful, it allows us to be in the moment and not fret about the past and worry about the future. And it has a series of benefits that are both psychological and health related. Meditation is the practice of mindfulness. It's a way to develop the skill of mindfulness. And it's a skill that we really have to be devoted to. Someone very wise said, if you're faithful to your practice will be faithful to you. So that's one of the things I'm going to try to bring out today. So what we're going to learn is, number one, how to be mindful in relationships. And we have an exercise, and actually I have a challenge for you on interpersonal mindfulness. That'll be number one. Second thing we're going to learn is how to use guided meditation. Now, in my mind, guided meditation is a little simpler because you don't have to focus your attention. You actually get assistance in focusing your attention. And we'll show you the ocean meditation that has a combination of someone guiding you, but also some video component where you can actually watch something. So again, I think it's much easier to focus your attention. And then the last thing I'm going to tell you about is the walking meditation. And I'll give you a demonstration of that as well. The walking meditation is, again, another way to be present in the moment, but it's particularly helpful with intrusive thoughts. So those people who have had traumatic experiences can't get away from those experiences. They're haunted by them. This is almost an immediate release for a few moments from those thoughts. Okay, so let me tell you a couple of stories and ways we've used these things clinically. And I'll start with Molly's rules about mindful interactions, about how to be more mindful in relationships. So Molly's a young lady who, when she was 9, went to a party with her parents. And after the party was over, she said to her parents she enjoyed the party. And the parents said, well, how come you enjoyed the party? And they said, well, there was somebody there I really liked. And he said, well, what did you like about the person? And she said, he made me laugh. He looked me in the eyes when he talked to me. He talked to me about things I was interested in. And sometimes he just sat and listened and smiled. And I thought that was one of the more profound things I've ever heard out of anyone, and probably only could come out of the mouth of a 9-year-old. And anyway, I thought it was an absolutely outstanding way to think about how to be mindful in relationships. So not long after that, I went to, I did a conference out in Ohio, and it was a 3-day conference, and at the end of the first day, a fellow in the audience came in and came to talk to me, and he said that he had a daughter with a disability, and they weren't getting along very well. And they loved each other. She loved him, he loved her, but every night sort of turned into a defiance on her part and frustration on his part. And he said, do you have any suggestions about what I could do? And I said, well, follow Molly's rules for the evening. If you can. That's a long time to do those things, but try. And so off he went, and the next morning, when I came back to the front of the room, he was waiting for me. And he said, I said, how did it go? And he said, well, he said, if last night wasn't the best night we've ever had, it's certainly one of the best nights we ever had. No defiance, no problems. She took her baths, she did her homework, she did all the things she was supposed to do. She was in bed, on time, and it was just a wonderful evening for everybody. He said, and but after he put his daughter to bed, when he came out into the room, his wife said to him, are you okay? And he said, yeah, I'm fine. And she said, you didn't lose your job, did you? And he said, no. And she said, well, you sure you're okay? And he said, yeah. And he realized that being mindful in this interaction with his daughter, which he thought he did all of the time, he probably did some of the time. And it had really remarkable results for his daughter, but a profound effect on his wife as well. So I'm going to challenge you in a little bit about how to use Molly's rules on your own and see just how powerful they can be. So the second thing we're going to do is guided meditation. And again, guided meditation to me is a simpler way to do meditation because you have someone helping you focus your attention. You don't have to sit on your own and focus on your breath, which is really difficult for some people to do, including me. And the third thing we're going to talk about is we're going to learn about is the walking meditation. And again, a very quick release for intrusive thoughts. So the guided meditation we've developed, I think, is really useful. And I'll tell you that it was a real surprise for me. Lots of the folks I work with have disabilities and real difficulties focusing their attention. So I wasn't sure they could do it. But I've been more than pleasantly surprised. So I had a young fella with autism who comes to see me regularly, and I brought him in, and he laid on the floor and sort of refused to watch the meditation, but I was faithful to it, and we continued to do it, and over time, things changed substantially with him. And so now, one morning when I realized this, he came in, and he sort of moves kind of like this, and as he came through the door, he sort of slowed down, and he said in a very sweet voice, "Ocean meditation, Al." And it's become something that's very important for him and very calming for him, and really allows him to be engaged with other people. The second little vignette about the guided meditation I want to tell you about is again this idea of being really committed to your practice. And if other people won't do it, you just do it. So we had a young gal comes in, and she's talking about, very traumatized young lady, and she's talking about some things that are really upsetting to her. We try to talk with her for a few minutes, but it just gets her more upset, more dysregulated. So we just switch on the guided meditation. And myself and whatever other people in the room, we just watch it. She's too aroused to even sit. She sort of wanders around the room a little bit. After the meditation, after the guided meditation, we go into a power pose, which always feels, by the way, really good after meditation. She started to slow down and finally sat down, and then we replayed the ocean meditation again. And at the end of about 45 minutes of us doing our practices, and her sort of just being in the room, she was able to sit at the table, and instead of this dysregulated person who was really unable to process any information, she sat quietly and told us all the things I think we would have told her 45 minutes before. So it was really sort of astounding, but again, makes the point that do the practice, and sometimes people join in with you, sometimes they won't, but over time they will join in and they will benefit. And the last little piece of the guided meditation that I want to talk about is a young fellow I just started seeing recently. And he's very avoidant, and I tried to get him to do some power posing on one of our first sessions, and he completely refused and shut down and actually turned his back on me. So we did the second best thing to meditation. We went and got a donut and made a plan about how to keep him engaged. And finally, after a couple of weeks, there was a student who used to be who was friends with him, and they haven't seen each other in a while. She's in a meditation group that I'm involved in, and so we decided to invite him to come visit her, and then for her to bring him into the meditation group. Well, she did. He came to the meditation group. She met him in the parking lot, walked him into the meditation room, and she put on the meditation. He sat for the full thing, watching intently the screen in the ocean, and at the end of it, he passed out. So the following week, we didn't quite stage it correctly, and he got there before everybody, so we couldn't meet him in the parking lot. She couldn't walk him in. He got on the couch. He went completely avoidant and shut down. and we couldn't get him into the meditation room. So the following week, we actually did it right, met him in the parking lot, and brought him in. And he did the meditation once again. And at the end of the meditation, the whole group did the power posing, and he did that as well. So that was interesting. And then the following week, he came in with his staff, and we put the meditation on, and he hushed them down so that he could watch the meditation. So again, you know, just be faithful to it. It'll work, but keep after it and be thoughtful about how you try to engage people in it. And the last thing I was going to tell you about is the walking meditation. And again, in my experiences, the walking meditation is very powerful, especially around intrusive thoughts. So we have a young lady who we've known for a long time, and like many young ladies, has some interpersonal problems with young men, or young men have interpersonal problems with her. And she was quite upset about this boy, and she was really concentrating on everything he said and what she should do, and it was really, really extremely upsetting for her. And so we talked about the walking meditation, and she said, that doesn't work for me. And we said, well, you've practiced it, but you've never really practiced it when you're upset. You've practiced it when you feel well, which is the way you should be practicing it. But let's try it now that you can't let go of these thoughts, or these thoughts won't let go of you. And she actually walked from up the hill down to the barn here, and then back. And when she got back, she was completely calm. And the intrusive thoughts were gone. And one of the staff said to her, you know, how do you feel now? And she said, oh, you know, that works perfectly for me. So again, it's interesting stuff, and you need to keep after it, and it will work. Okay. So let's move on to some demonstrations. And the first one is really more of a challenge than a demonstration. It's the formula that Molly laid out for her, for the interpersonal mindfulness, for being mindful in relationships. And again, it's very simple, and you'll see it on the screen. And I want to challenge you to do it for 5 or 10 minutes with somebody and see what the results are. And again, very simple. If you can, get the person to laugh. Look them in the eyes. Don't look at your watch. Don't look at the phone. Don't look at the door. Don't look away. Look them in the eyes. Let them know that they're the most important thing there is in that moment. Talk to them about what they're interested in, which is a difficult thing, especially for a parent, because we're always concerned about, is the homework done? How was school today? When is dinner going to be ready? And all of those things. Sit and talk with them about what they're interested in and nothing else. And finally, just sit and listen and smile. And I think you will find that will have a profound effect on how people respond to you. And most of us think, like the fellow from Ohio, that that's what we do most of the time. And unfortunately, it's probably not. So the second thing we're going to do is the guided meditation. Now, we have put together a guided meditation that I think works very well, especially for people who are slightly resistant to it. It has multiple components. It has the voiceover guide, and I think you'll find that the voice is calming and slow, which again helps people to regulate themselves. The video is of the ocean, which most people, of course, find very calming. And you have the video to attend to, and the guide helps you attend to the video. So you get to focus your attention with some help, and I think it's quite powerful. It's available at Ocean Meditation Ilia Vecchione, and we'll put that up for you. And use it anytime you like and share it with others. And I think you might find it useful. And so we'll give you about a 2-minute clip of that. And then if you're interested, you can get the rest of it on your own. And the third piece here is the walking meditation. Now again, the walking meditation, as I just said, really helps with intrusive thoughts. And it's really very simple, and it involves not only walking, but walking in a slightly different way than we normally do, and repeating something as you do that. So I'll give you that example in a second. Okay, so now I'm going to give you a demonstration of the walking meditation. And let me tell you a few things about it first. Most of us walk heel to toe. In the walking meditation, we're going to walk toe to heel. Now that'll force us to concentrate on what we're doing. And at the same time, we're going to repeat toe, heel, as each one of those things touches the floor. And we're going to do this nice and slowly, which again will give that message to our brain that we're safe and to be calm. Okay, so let me show you how to do it. And again, very simple. Nice and slow. Toe, heel, 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 all the time, just moving nice and slowly and repeating that phrase. And you'll find toe, heel, toe, heel, toe, heel, toe, heel, toe, heel, toe, heel. And you'll find after you do that, just for a couple of minutes, whatever it was that was bothering you will be gone. So walk on. All right, so now I'm going to tell you a little bit about a few of my favorite research pieces. And if you'd like more, there's a bibliography at the website, tamingthetigervt.com. So first I'll give you just this kind of a brief overview of some of the research, and it's quite substantial. There's thousands of articles now published in the scientific literature on mindfulness and meditation. And it covers multiple areas, but one of the primary ones is the changes that meditation can cause in the structure and function of the brain, and fairly quickly. Jon Kabat-Zinn's program on mindfulness-based stress reduction has shown these kind of changes in just as little as 8 weeks. And there's actually one study that shows some of these changes in 11 hours of meditation. That's really quick. And so what you're going to find is that there are changes to your frontal lobes. You get a thickening of the cortex, which increases the power of reasoning and organization and planning and all of your executive functions. You also get a decrease, a shrinkage in the size of your amygdala. And the amygdala is really the seat of your fear response. So essentially, it empowers your frontal lobes to have some control over your limbic system. So it allows you to be more reasonable in the face of frustration, fear, threat, or danger. One of the more interesting brain changes is actually the change in your lower brain, in your medulla oblongata, your what they call the reptilian brain. And the reason that's so interesting is that that is the interface between your brain and your body. So when you get a thickening there, you get your body and brain more connected. So I think those are really interesting results, and they happen fairly quickly. The second thing is that there are cognitive changes. So based on those structural changes, you'd expect there to be some cognitive changes, and you do find increased ability to manage your attention, to focus on things, memory improvement, and concentration, which are all wonderful. Most of us could use. Then there are changes in emotional regulation, lower frustration, lower anxiety and depression, and I'll show you some articles on that in a little bit, and just overall increased capacity to regulate your feelings. There's some interesting changes in the sense of self, and those parts of the brain, the neural networks that organize the sense of self, get reorganized to the extent that we're more able to get out of ourselves and better able to be mindful in the moment and not have to worry so much about our state and what's happening to us. There's behavioral changes, and that's probably the most important one. To us, there's changes in the ability to self-regulate, which means that you get less avoidant and less explosive behavior, and an increased ability to reach out to others when we're distressed. And finally, believe it or not, there's even immunological and physical health changes. So there's a number of studies now on the immune system and the improved function of the immune system being more efficient, reacting better to outward kind of threats, and less reactive to your own body. So the immune improvements are quite substantial. All right, so that's number one. Number two is a study on meditation, but it leads you back to the vagus nerve, which is always interesting, and it leads you to physical health. So there's not a linear relationship here, but the way it goes is that meditation improves our affect. More positive emotions when you meditate. More positive emotions, again, turn on that vagal brake. They allow your vagus to calm your heart, to send a signal to your brain that everything's okay. And when it does that, it allows your parasympathetic nervous system to be available for rest and digest. And so your parasympathetic nervous system can't be focused on defense in order to create physical health. It has to be able to focus on the body. And it's called the rest and digest system. So I thought that was a really interesting study as well. There's a couple of studies I think that are interesting on, again, on behavioral stuff, on anxiety, on aggression, and on overall psychological well-being. And so the references will be on the screen. Here's the most interesting one to me. And it's a small study, limited number of patients. But they're patients with aggression. And aggression is a really difficult thing to deal with, and generally is dealt with by using consequences. Not by calming the body, but by taking things away or giving you things for being good. And in this study, they use meditation. And a partial way through the study, they've dropped the aggression by about 2/3. By the end of the study, in these patients, there's no more aggression. And they do a 4-year follow-up, and they've had no more aggression over the course of those 4 years. That's pretty outstanding. Now, I don't really know anything that works quite that well. Another interesting study is on post-traumatic stress disorder. And post-traumatic stress disorder, generally speaking, medication treatment does not work very well. In fact, most treatments don't work very well, other than for acute trauma. But for PTSD, there's a study on meditation, and it had pretty outstanding results. They get a large effect size. I think it's 8 weeks of meditation. There's a large effect size for PTSD symptoms, and there's a medium to large effect for depression. That's really interesting, but there also is a large effect for self-compassion. So I think part of the drop in symptoms may be related to this more caring relationship with the self, the ability to understand why it is you're doing what you're doing, and allowing you to be more mindful. And in fact, there's a medium to large effect for mindfulness as well. So that's pretty substantial. And the last thing I really want to talk about is when you think about these studies, most of them look at mindfulness or meditation in comparison to placebo. In other words, a no treatment group. I think it's less interesting, or more interesting, to look at what are some of the treatments that work, and how does mindfulness or meditation compare to those treatments. So this is a study on CBT, cognitive behavior therapy, which is probably the most evidence-based treatment for post-traumatic stress disorder. Not necessarily the best, but a very good treatment, a very well-researched treatment. And mindfulness and meditation show no difference. Cognitive behavior therapy and mindfulness or meditation show no differences in treatment. Very significant results in all areas. Now, what is different about meditation and cognitive behavior therapy is that meditation can be delivered in a group and can be done at home. CBT, or cognitive behavior therapy, is done by an individual therapist in an office just with you. So it allows us to treat many more people as effectively using meditation as cognitive behavior therapy. And so the cost and the access to care is, cost is much lower, and the access to care is much greater because you can do these things in groups. So there's the research. Again, go to the website if you're interested in more things, and meditate on.